I think we are live now.
Yeah, I feel let's wait for another 2 minutes, maybe for a few more people to join, and then we can start.
Sure, sure.
Okay.
Okay, I think we should start now. Should we start? I think we should start now. Okay. Should we start?
Yeah.
Okay, so good morning, everyone. I am Divya Krishna Kumar from Vellore Institute of Technology, and I, along with my co-host Asha, would like to welcome all viewers to Coffee with CEO, organized by IEEE EMBS in collaboration with SABEST VIT. Today's interactive session features Ms. Anmol Saxena, co-founder and CEO of Ashva Wearable Technologies. Ms. Saxena is an alumnus of VIT Vellore, having graduated in 2017. She interned at and then worked as a design and release engineer at Ford Motors, and then went on to establish Ashwa Wearable Technologies alongside Sandeep Reddy Golugure, with the goal of developing world-class skeletomuscular healthcare access to all. Please join in welcoming. Please join me in welcoming Ms. Anmol Saxena. Hi, how are you doing today?
Hi Divya, hi Asha. Thank you very much for having me here. And I'm delighted to be a part of this VIT student body organized webinar. So thank you very much. I'm good. How are you guys?
I'm
Very
good.
good. Thank you.
We're good. Okay.
Yeah.
I
So
think
should we just get right into the questions? Yeah. Okay. I think we have enough people. Am I audible to everyone? I hope so. If I'm not clear, please let me know. Okay. Before we discuss what Ashwa is doing right now, tell us a little about your journey in VIT and how it helped shape what you're doing today.
So I joined in 2017 and I was a student of electrical and electronics engineering. Right from the first semester, robotics and electronics was something that intrigued me a lot. In the first semester itself, I remember making around 9 small bots, which included something simple like a joystick control bot, an IR sensor-based blind detection robot, so on up to DTMS, that's dual tone multi-frequency, and GPS-enabled robots. From there on, it was basically a journey of joining different teams, developing different technologies. Another thing being, a child of a typical Indian parent, my parents always pushed me for a lot of internships. So right from my first year, I had been doing internships. So my first internship was with NTPC at Surat Pal, wherein being an electrical engineer, I was exposed to AC machines, generators, and live plants for electricity generation and distribution. In my second year, I interned with Alstom in Vadodara. There we learned a lot about transformers, designing of substations, and so on. And I was at that point of time exposed to Microsoft Excel, Macros, VBS, these kind of technologies for designing and development for engineering purposes. The third internship was with Schneider, one which I had a very interesting interview because at the time I went to interview for this engineering internship. They, I think, mistook me to be an MBA graduate there to interview for HR, and I actually ended up in my first stress interview. But then when they realized that I'm just here to do a 2 month long internship, they kind of tuned it down a bit. And then my final internship was this on-campus placement with Ford Motors Company. So after Schneider, I had done an internship on how PCBs are manufactured and assembled in India for high electricity inverters. These inverters that were manufactured in India were actually used in the Beijing Olympics. So I was a part of that inverter manufacturing for 440 kilovoltage. So then coming fast forwarding to the Ford internship, that's where I was exposed to a lot of techno commercial aspects of product management and product development, where I learned about audio infotainment systems in cars. My role in my 2 month summer internship was basically to go to different competitors and understand what offers they are giving to the customers, what is making the customer happy, and then, kind of create this market research around it. And that was what really interested me, because after that, when I joined Ford as a full-time employee, I was I actually took my own business study forward into engineering, and we implemented a new a new audio infotainment system with features that delight customers, with latest technology, at a price point that delighted customers. And that is, I think, where my product development and product management journey actually started, which has helped me tremendously in converting, all my experience, all my learnings from field into my own startup. Yeah. So yeah, that's
Okay,
more or less what my
thank you.
journey in VIT was.
Um, Another question: have you always wanted to be an entrepreneur, or did you want to pursue a different path when you were younger?
Oh, not at all. So entrepreneur just happened. My father is a government officer. So this was always in my head. Okay, I want to do UPSC and I want to probably become a government officer someday. One thing I had very, very well since my early childhood was a keen interest in engineering. And it really began with electrical engineering, where in school, I conducted a couple of experiments. So just to understand the conductivity of water, conductivity of metal, we used to pour water on our table, and then the lighter, a lodestone, which like a cigarette lighter, the lodestone. We plucked it out, and then we tried to, uh, have one guy put his finger on one end of that water, and we touched the lodestone on the other end, and we saw what happens. Then we put a coin and water, and we saw how the electricity is conducting. So right from there till probably 12th standard, where I was absolutely certain that electricity is where, electronics is where I want to go. We did not have a lot of exposure as today's students have. We did not have a lot of exposure in 8th and 9th standard on Arduino or on microcontroller based programming languages and all. But this was something that I was exposed to through my own seniors and my own friends who were already working in robotics. And I think that's where the interest in engineering came about. From the first semester, I was absolutely certain that electronics and technology, in this sense, hardware based technology, is where I'm interested. And then by fourth year, I kind of realized I had attended a lot of hackathons, and I had attended a lot of these boot camps for entrepreneurs for one of the healthcare devices itself that I had made as a part of student project team. That entrepreneurship is something where my heart lies more than a government job or more than a corporate job. Uh, I took up a role at Ford Motors Company after that to kind of get exposed to the industry. Initial plan was to stick there for 3 years, but then when I realized that I now have a team, I have a problem statement that is absolutely important to be solved. That's when I thought, 1 year into Ford, I thought that I think it's time to call it quits here and have my own startup. So it was a very organic process that got me towards business and entrepreneurship.
Okay. Could you tell us more about what inspired Ashwa? as a startup, and what problems were you directing this startup towards? What were you trying to
Right.
solve?
So, believe it or not, I was around 30 kgs heavier than I am today when I was in college. And I was very adamant to lose my weight because I had started facing a lot of back pains and knee pains. Um, when I used to walk, because our campus, VIT campus, is also very large, and you walk across. I was 130, 120, 25 kgs back then. I used to play a lot. I was always a sporty person, but because of my body weight, it wasn't allowing me to play without these pains in my knees, these pains coming again and again in my back. And that made me very upset because I like leading an active lifestyle, but I love eating as well. So when I decided to start my weight loss journey, I used to run in our girls hostel ka basketball field every day. But because I was running with obesity at that time, I further injured my knees, and it became so terrible that I actually had to take a consultation. I had to undergo MRIs and CT scans for damage to my knee cartilages, tendons, and tissues at CMC hospital. Now, once I understood, I was, what the issue was, I was basically clinically diagnosed with knee osteoarthritis. It's basically this wear and tear of the knee joint that is caused because of overstressing or because of old age. So here I was, a 20-year-old person with knee osteoarthritis already. The doctors, the physiotherapists told me that I'm not allowed to continue running. I am supposed to do, alternative load bearing exercises, but I did not have a lot of alternatives back then, being in hostel. And so I started looking for solutions to help me continue my weight loss journey, but then minimize the effect on my skeletomuscular system. That's when one fine evening, Sandeep, that's my business partner, and we were discussing about some ideas that we should be taking to a hackathon. And I just come back from a run, and I was quite a lot in pain. So he actually suggested that we look for, like, he suggested, why don't you look for some solutions? And I told him that physiotherapy is one of the only things that has been working for me. Kneecaps and all are not really doing the job. Being a student, I remember spending 7,000 rupees on these Reebok shoes, which had high cushion and everything, so that I could continue my weight loss journey, which really did not help me at all again. But that was a big thing for me, spending 7,000 on shoes. And so he said that, why don't we make a system that can help you continue your weight loss journey, but then at the same time prevent your skeletal-muscular system from impacting. So that is where the inspiration for our device FITKNEES started. And today FITKNEES has become this intelligent diagnostic platform, which basically does monitoring of the progress of patient in physiotherapy, and keeps giving them feedback every week about how they're progressing uh, pertaining to the knees mobility, muscle strength, balance, proprioception, gait, the style of walking, whether they are climbing up and down the stairs with correct posture or not. And it keeps allowing them to connect with their physiotherapist even remotely, so that they can know whether they are improving or not, and if they're not improving, what exercises will help them improve. So that is what actually inspired this entire journey of fitness.
It's very
This is
inspiring.
fitness, by the way.
Um,
So these are our new cores of fitness, and from this, now we have gone to a wearable device of this size. We're very excited about the size, though.
um, um, how wide would you say the market for skeletomuscular wearables is, and how seriously do you think people are taking osteoarthritis as a disease?
So, about the market size of osteoarthritis, first of all, about wearable devices, sorry. First of all, India has around a market size of 3 billion US dollars, which converts to roughly 22,000 crore Indian rupees. The orthopedic market is growing at a very phenomenal rate in India right now, almost 25% compounded annual growth rate. Uh, that being said, healthcare sector as a whole is seeing a global transformation in the way healthcare has been delivered to patients so far. So far, what and my peers, I and my business partner saw on field. So we were on field for around 6 months. Uh, we saw that currently the healthcare trend is very reactive. And this is something that a lot of experts, of course, acknowledge as well. When I say reactive, I basically mean we react to a heart attack, or we only give medical intervention when a person has stroke, or when a person faints and we realize it's diabetes. This is primarily because so far we have very broken up or staggered form of medical testing. We occasionally go for blood workups, we occasionally go for EKGs. It's very intermittent. Now, when you talk about wearables, the reason why it's gaining so much popularity is two. One, people have started understanding the importance of predictive analysis. See, 90% of your diseases and injuries actually happen because of your lifestyle. So, what is the actual treatment that is given in a hospital is just that 10%. It's all inside the hospital, inside the clinic, and you actually go back to living the same lifestyle. To create a difference in your disease, 90% of the monitoring and intervention has to be done in your lifestyle, isn't it? Wearable technologies are going to enable this kind of monitoring. So when you are talking about epidemic or very large scale diseases like diabetes or osteoarthritis or heart cardiovascular problems, these all will start becoming better only, or these numbers will start reducing only when you start monitoring remotely, when you start monitoring what the patient is doing in their life. And then all this data has to be looked at by a physician or a clinician or a doctor, as we call them. And then you are actually going to start understanding the root causes of all these problems. So it was estimated that by this year, 2020, around 40 million people will be monitoring their health remotely. Actual numbers are much larger already. So in Canada, a very good application has been of diabetes. Wearable technologies that can continually monitor the blood glucose level non-invasively through IR sensors are being used in Canada, and the population has already shown 37% reduction in diabetic cases at early stages because of these wearables. So this is going to definitely take off very tremendously. Now, talking about COVID-19 and how that has also accelerated the pace of absorption of telemedicine and wearable technologies, uh, it was estimated that by 2025, you're actually going to see the true potential of remote monitoring, telemedicine, and wearable technologies coming into play. But because of COVID-19, people have already started this much before time. Because now more than ever, people are adapting to digital platforms. They are understanding the need of wearables, also of clinically approved medications and devices for remote monitoring. Companies like Omron were always there to kind of give you those heartbeat, those BP monitoring that you could put on your wrist, calculate BP, etc. So, having said that, globally, the market has suddenly seen a push in the CAGR, the compounded annual growth rate of wearables in healthcare. Coming to your second question, osteoarthritis. Give me 2 minutes, please. I'm going to have a sip of water. Okay. coming to your second question on osteoarthritis and how seriously people take this disease, when we were on field, we saw that patients do come in when they start getting recurrent knee pain. They come in, um, they usually tend to, move ki malish karte and they move ahead. They ignore it. They only come in when the injury gets very severe. Main reason for this, and we have spoken to doctors in AIMS, in Manipal Hospital, there is a big lack of awareness as well as ignorance. Patients, first of all, are not aware of the symptoms. They're not aware of things like if, when it comes to knee osteoarthritis specifically, if your knees pain very often, if you're getting joint stiffness, especially after sitting for long hours or after waking up in the morning, if the weather is cold or rainy, you can have joint problems. Slight overloading activities can cause swelling in your knees. All these are early indicators of osteoarthritis. If patients don't are not aware, if people are not aware that these are the symptoms, they will probably not take the right steps towards their healthcare management. Furthermore, even if they, through self-assessment, know that somehow they have arthritis, they don't go to the doctor till it becomes very severe. So almost 85% of the patients we saw through our field trials were patients who came at something called grade 3 osteoarthritis. So there's an international scale called the Kellgren-Lawrence scale where osteoarthritis is mapped. Grade 3 happens when in the X-ray you can actually see that there is a lessened space between the bones, okay, that comes up in the X-ray. There are something called bone spurring, like bony bone projections, because the bone is rubbing on bone. There are small bony projections around the knee joint. That stage is when patients actually come into hospital. And that's scary because at this stage, osteoarthritis cannot really be reversed. You can maintain it for as long as possible, but over the years, it's just going to get worse. However, it is clinically proved that if patients are aware and if they are proactive in maintaining their knees and their skeletomuscular health, if they come in at grade 2, where in the radiological imaging in the X-rays you don't see very significant bone spurring, but you see slight offset of the gap between the thigh joint and the shin joint. You start seeing slight spacing reduction. You can actually, through right physiotherapy and conservative methods, reverse osteoarthritis altogether. And I have seen it personally. I followed the journey over almost 7 to 8 months of this manager at Intel. He used to come at grade 2. He was a sports person. He had taken physiotherapy. He took the right steps. He took rest. He stopped climbing stairs. He reduced his weight by swimming. And his osteoarthritis reversed. It is possible. But people are not aware. People don't take action at the right stage. If they don't take action, ultimately what's going to happen? Osteoarthritis is going to aggravate and they are going to be either wheelchair bound or bedridden. There'll be almost complete disruption of physical movement in their life and they'll have to opt for knee surgery. That's the only option for them then. And trust me, when I say this, knee surgery is a very temporary solution and it is not going to give the wholesome life that you expect it to give. Because I've seen patients live with limited mobility even on knee surgeries. So to answer your question, it is a serious problem. In fact, by 2050, WHO predicts that India will be the osteoarthritis capital of the world, with 60 million Indians being diagnosed with knee osteoarthritis per annum. But still not a lot of things are being done about it.
Okay. So you've talked about FITKNEES. Do you have any other products that help the healthcare industry here?
So our focus is on fitness right now as a platform. Through this COVID virus, we actually came up with a mobile application. It was initially a part of FITKNEES itself, but we have added a video consultation feature so that for physiotherapy patients alone, patients can start taking remote physiotherapy. We have a doctor. His name is Dr. Padmanabhan Shekharan. He's the Chief of Rehabilitation at Sparsh Group of Hospitals. He has been mentoring us. He's now a Chief Scientific Officer as well. He has developed a workflow for predictive analysis of what diseases might a patient have and what is the potential treatment protocol. So we plan to integrate this into our ecosystem so that patients can get, instead of just a normal video consultation based remote monitoring or video consultation based physiotherapy, they can actually get data driven physiotherapy as well. Other than this, we have a second product called Mudra, which we are working on in Sidelines. This is a device, a small wearable device that you can put on your back. I think a lot of us might remember this theory called Pavlov's theory, where the scientist Pavlov used to put a bowl of food in front of a dog and ring a bell. The second day, he put a bowl of food in the front of the dog and rang the bell. I guess you're recalling it. The third day, he did not put the bowl of food in front of the dog, but he rang the bell. And the dog started salivating. Yeah. So the dog started salivating, and that was an involuntary reflex. So using the Pavlovian theory, this is called involuntary conditioning. We have developed Mudra, where every time you slouch while sitting on a table or a chair, you're going to get a vibrational feedback. As soon as you get a vibration, it's not going to stop till time you don't sit back up straight. So eventually, over a period of time, anywhere between 21 to 66 days, every time you slouch with or without the device, you'll be conditioned to remember that uncomfortable vibration sensation and you'll just sit back up. So those are the two products we're working on.
Okay. We've heard that there's a product launch later this year. Is there anything you can tell us about that?
So this is a product launch of the FITKNEES wearable itself. We are right now currently doing clinical trials with St. John's Hospital. We are conducting trials to basically identify how good we are versus gold standard and how reliable is our sensors over a period of time with the patient. When we establish our clinical statistics, we will be going into regulation. For our device, Indian regulation is kind enough to not have very severe regulations imposed on us because we are completely on the surface safe and we have something called substantially equivalent FDA devices already in market. Based on that, we will be launching our device in December. We'll be launching with 3 big hospitals. I'm not naming them now, who we are also conducting these demonstrations and trials with. These devices will, to begin with, our go-to-market strategy is to place these devices in the hospitals itself, test it with patients, and then over a period of time, start converting the hospital and transitioning from hospital to the homes of patients.
Okay, so something a startup really struggles with is funding and reaching profitability. What was your funding journey like? And could you talk about seed funding and VC funding, everything?
So we have not raised VC. I'll tell you our funding journey so far. To begin with, for any startup, the first few things are the 3 F's: friends, families, and fools. So we bootstrapped through our friends, families, and so-called fools. We also had won a lot of hackathon awards that helped us kickstart our prototyping, something called proof of concept journey. After that, we raised a DST, Department of Science and Technology grant from VIT-TBI itself. The grant scheme is called Nidhi Prayas Grant. VIT keeps running these grant applications every 6 months or so. And you must have seen it probably, a lot of mailers also fly by. These are specifically for hardware startups in the biotech and agri-tech industries. That is up to 10 lakhs. That helped us go from proof of concept to an alpha stage prototype. It took us around 9 months to complete that journey from POC to prototype, the first prototype. After that, we raised the BIRAC Seed Fund Award. BIRAC is a body of DBT, that's Department of Biotechnology. That is a maximum of 30 lakhs, which has helped us go from alpha to beta and MVC, minimally viable concept, MVP rather, minimally viable product. Now that we have our devices in place and we have started clinical trial, we have raised another round of grants, which is again through BIRAC. It's called the BIG, BIRAC Ignition Grant Program. This also runs every 6 months. January and June is the call, I guess. And it is up to 50 lakhs of grant. So we have been awarded this through a government body called IKP in Hyderabad. It's a very big, extensive knowledge park that caters to almost 200 startups now. And I think our next step is angel investment. Talking about VC, there are stages in an investment plan for any startup. So the first thing, of course, as I mentioned, is bootstrapping. The founders can put in their own savings, they can raise it to friends, family, school. The second stage is essentially a pre-seed. That is what the Prayas grant was for us. Then is seed, then comes angel. Angel investment is when you're essentially scaling up. You've got some early traction in market. Maybe in healthcare, you have at least 30 to 50 paying customers, and now you look to scale up to the next level. I think that is where experts say that angel investment come in. When you have a good significant number of market, let's say you've established yourself in Bangalore or a city, you technically start looking for bigger funds. You start diluting bigger portion of your company. That is called Series A. Series B, C is where technically the venture capitalists start coming in. When you are significantly big, you are prominent in at least multiple cities, or depending on domain, you are prominent, and now you need big investments to the tune of million, or maybe even billions of dollars. That's when the venture capitalists start coming in, and start really taking you national, global. So that's been our startup journey so far, funding journey.
And what are some challenges you would say you'd faced during this the initial stages of Ashwa, and what challenges would you be facing now as a sort of
Right. So I
established
think
company?
Right. So I think every day is another challenge. Um, some of the biggest challenges that I think are common to a lot of startups and were to us also were uh, fundraising. Fortunately for us, wasn't because of VIT and because of the biotechnology ecosystem we are in. But fundraising is a challenge for a lot of startups. Um, for recruitment, talent recruitment and attraction is a major challenge for startups, because sometimes for us it felt that um, talent, the young people or the young talented engineers want to intern with us, but they don't want to stick with us in the long term. After interning with us, students usually tend to learn a lot of skills, they pick up a lot of professional ethics, and they leverage that to jump into MNCs, which is unfortunate for us, because we as entrepreneurs have invested significant amount of time and efforts into training these young students and young talent. They have put in a lot of effort to hone these skills, and then after a period of time they leave to find better opportunities. But that is how the business world works, not just for startups but probably for corporate as well. Retaining talent is also another challenge. So even after 1 year, we have recruited a team of 3 full-time employees. engaging them in our total work culture, engaging them in day-to-day business activities, helping them find confidence and find motivation at our work is something that as founders we also have to bear the burden of, keeping them continually engaged while managing all the other parts of business. Because as a startup, you're a very small team with limited finances, limited time, limited resources, limited people, and you have to technically be the technology developer, the business developer, the networking person, the digital marketing person. You're also, talking to your patent attorneys, your CA, you're doing GST filing, you're doing everything. So it is a challenge when it comes to also your personal time management, your personal motivation, discipline. You have to continually keep your energy levels up because that's how your business, your team, and your product is going to reflect. If you're going to be all thakela and too much is happening, I'm going to take a break for 2 weeks. वो नहीं चलने वाला है. So you have to be on your feet. You have to be constantly motivated. You have to continually upgrade your skills. So if the business requires, let's say, um, being an engineer, if the business requires business development, you have to sit and study MBA textbooks. You have to look at Harvard Business Review classes and then actually come up with a formal structure for your business. So that is another challenge, time management and self motivation for founders. On a personal level, I and my co founder Sandeep, uh, being in Ford and Intel with Super Dream packages, we used to have this habit of ordering out every weekend, going for small trips whenever we felt like. But then cash had to be conserved very tightly. We started, instead of traveling by Shatabdi, we started traveling by, non-AC, second class trains, buses. That all also started playing a bit with our mental health. So personally, I was a little sad to give up on the luxuries of life, but then I think that has also, of course, taught me tremendously. Uh, Another thing as a startup we faced was the technology, the speed with which the technology is developing and the demand of technology in the market. While being young and acquainted with them, we have to be very nimble and agile at adapting them and recognizing the right things at the right time. Our product development took a big hit, almost by 3 months or so, because we were actually not able to understand that instead of focusing on the technology alone, we have to focus on the customers and on the fact that we are providing a product to the customer. So I spoke about the Cure app, right? We actually realized almost after 3 months of development that, hey, Flutter app development was not really something that we had to absolutely go into. Even if we would have enabled the same features through a website, that would have been adequate. At the end of the day, it's about the patient and the value you create to the patient. The patient doesn't care whether you create your product on a Flutter platform or on Android and iOS native mobile app. They care about the fact that you are providing a valuable service to them. Your customer service is good. You are very quick on responding to the feedbacks and rectifying their problems. That is more important, and that I think we learned in a very hard way. Um, and I think the final thing that we also face an issue with was because we don't come from a medical background, we had to continually knock on the doors of all doctors and all hospital administrators ourselves. That was a very challenging task. So we used to sit for hours outside a big doctor's hospital to actually get acquainted with them. Once we have built the relationship and nurtured it over the last 1 year, we were actually able to take things easier. And now we have a lot of physiotherapists, a lot of orthopedics taking keen interest in our startup. But initially, for us to get that level of trust was extremely challenging. So these are just some of the challenges, but every single day I think is another day, another challenge, and I think that's what also keeps us on our toes all the time and keeps nurturing our experience at Ashwa.
Yeah. Okay. Okay. So consumer affordability is something that everyone looks for. Everyone wants the product to be affordable. So how do you balance that with profitability?
That is a very interesting question because India, in the words of the Ninja Kachi Thiru, is like an onion. You peel one layer, you're going to get another layer of problems. You peel another layer of problems, you're going to get another layer of problems, and you're possibly never going to get to the core. So profitability in India is a very big challenge. As Ashwa, our vision is to ensure that physiotherapy at the highest level and highest standards is accessible to everybody, which is why our vision is democratization and decentralization of world-class physiotherapy to all. This means that it's not just the technology, but the affordability of using this technology by the patients as well. To ensure that we are profitable and at the same time affordable, one very important factor that will play a role for us is economies of scale. Because economies of scale is basically when you start manufacturing at bigger level, the cost of manufacturing your devices come down, right? So if I manufacture 100 components and 100 PCBs and 100 products, that's going to cost me much more than when I manufacture products. That's going to cost me much more than when I manufacture 1,000 of them. Our plan is to basically have these key relationships with hospitals and centers where before we started the product development, we are able to get orders, pre-orders, so to say. We have letter of intent. Through this letter of intent, we are ascertained that at least these many number of hospitals are going to use our devices. When we go into manufacturing, we'll at least manufacture this much minimum quantity which will be sold. Thereafter, it is all about how we execute the technology, how good a customer service we provide, how proactive we are in taking the on-field feedback and rectifying and improving our technology, our strategies, and then ensuring that the product is quickly and amply scaling in the market so that more and more hospitals, more clinics, and through them more patients are adapting to our devices. I would probably think that a more seasoned entrepreneur than me should answer this question of profitability versus affordability because right now I can speak in theory and I can speak in strategies, but since I have not done it, I think I will be probably next year when you have a series, I'll be able to share this feedback.
Okay. We're going to wrap up soon because we have a bunch of audience questions which we'd like you to address. So, do you have any advice for startup, those who want to start up a company or who are young entrepreneurs? Do you have any advice for them?
Um, I think the first thing would be if you want to start your own company, just do it. There's going to be no right time. My partner had to be properly choked and abused to actually quit his job and come and join with me. Um, so he had this problem of family. He's the eldest son. I'm the younger daughter, so I don't care. My sister's taking care of things. But he's the eldest son. He wanted to see the right time to enter the startup. And I think up to certain level, even I did. But there's no right time. Just go for it. Second important thing is don't have a useless startup that you have just cooked up in your head and you feel, yeah, probably this is needed or this is a cool idea. That's not how things are going to work. Before we actually incorporated our company in 2019, that's last year on 1st of 2019, we already, while being in corporate, had done a lot of market survey with physiotherapists, with orthos. We had, after leaving, also continued to go to gyms, to go to rehabilitation centers, to visit hospitals, to understand the healthcare ecosystem, to understand what devices are used, how they are used, why do people use it, what are the responses, what are the new things coming. We did a lot of online studies. I think this is very important to understand that this is what your customers need. So it's not that you can create a supply and always you'll have a demand. You have to look at the demand. You have to look at the uh, problem and then address those problems. Don't address your problems. So that's the second advice I would like to give to entrepreneurs. And I think the third advice is no matter what happens, just remember why you started it, why you started this journey. Because as I mentioned, every day is going to be a challenge. It will get very difficult at times. And you'll probably feel like pulling your hair out and, just running amok and shouting. But don't give up. Just remember why you started. Don't start because it's a trend or a fashion. Start because you want to. Start because this is what your calling is. Because if you don't, at the darkest of times, that's the time when you'll probably give up. But if you started it because you're passionate about it, you will remind that this is why I started. I'm passionate about creating value to this set of people, or I'm passionate about solving this problem, or I'm passionate about leading people or building a business. And probably that's what will keep you going even on those times.
That's really good advice. To wrap up with our last question before we go on to the questions from the viewers who are watching the live, where would you see Ashwa in the next few years? And how do you see the future of healthcare related startups going?
I don't know what will happen to Ashwa tomorrow. I would hope to have it as I would hope to see it flourishing, at least catering to. So my target personally is to cater to 10,000 patients in the next 3 years. That's the number we have put up, and at least infiltrate to 500 physiotherapy centers and hospitals and create value to these hospitals and doctors. We also want to standardize physiotherapy as a whole. Another problem I faced was different hospitals and clinics had different methods and different devices. We want to standardize everything, whether I go to my Gali Nukkad ka physiotherapy center or I go to a big hospital, I should get the same treatment, same healthcare at an affordable rate. So I would hope that in the next 3 years we achieve our target and then let's see what happens from there. Another important parameter for us is to actually leverage the latest technologies, including AI and other deep technologies, to start creating even more impact and value to the life of people. When I talk about healthcare, as I've mentioned, especially after COVID, I see a very quick boom in three sectors. One is telemedicine, one is wearable technologies, and continuous health monitoring plus predictive analysis. I would put all those in one category. And the third thing is in rural healthcare, these remote kiosks or remote setups coming in. Places which have never seen healthcare will now start seeing world-class healthcare. I think that is the future of digital healthcare. Of course, a lot of other things like digital prescriptions, remote surgeries through virtual reality, augmented reality, and AI, high precision robotic instruments for doing the surgery, delivering healthcare to patients. These are going to be some things that are going to come in, but according to me, these three things are going to be very prominent in the upcoming years.
Okay. Okay, so we'll start addressing audience questions right now. There's a few that we have. Nisha Stewart has asked, could you give us some tips on networking effectively with other entrepreneurs as well as potential investors?
Okay, this is something even I learned the hard way. Um, so the first important thing is do not stay stuck in the four walls of your office. Once we finished our R&D, I actually started going to a lot of conferences specific to my domain. So wearables, electronics, and healthcare was where I went. Depending on your domain or depending on your interest, you should start attending these conferences across India. Even if that means taking a weekend off from your college and traveling over there, you should start doing this because that is what is going to broaden your mind. Second thing, networking is something that will only come when you actually start going on field. Initially, you will not talk to many people. You will try to look for familiar faces. Gradually, when you start talking to them, you should observe how other people are discussing with each other and then start doing the same thing. Essentially, going from stall to stall, going from person to person, and talking to them. One interesting way to network with experts is through platforms like these, where experts are coming up as webinar speakers or in the older times as stage speakers. And after that, you actually get a time to network with them one on one. Do your background checks on these experts and go talk to them. They're going to respond to you much better. Even if you're a student, don't hesitate. Tell them I'm a student, I'm here to learn. People will always be happy to talk to you. Ask them questions about their industry. What do you think this will happen? What do you think will happen in your industry? What do you think will happen to your business? You will get an exposure to that industry instantly. To network with fellow entrepreneurs, startups are a very small world. And I realized this over the past few months. When you go to these conferences which are targeted to your domain, you're going to see the same faces again and again. That's when you start nurturing your relationships, not just introducing yourself to different people, but actually start nurturing your relationships with them. They know you, you know them, you're familiar, and that's when you actually start exchanging questions, exchanging help and support in various ways. And I think finally, um, just don't be a fake person. There are many fake people. When you go to these conferences, 1 out of 10 people are genuine, and 9 out of them are very fake and very show off kind of people. So I would suggest if you are a genuine person, you're automatically going to attract people. Um, yes, I think that's what I can give from my side.
Okay, so the next question comes from our the Electron Labs. It asks, who or what do you see as the closest equivalent or competition to fitness in the global market, if there is any?
Okay. So first of all, hi Abhijit. He's my friend from Electron Labs. We're talking after a very long time. Okay, so by the way, guys, Electron Labs is a startup based out of IKP itself, and they are an MS Ramaiya startup. They're doing fantastic technology work. To answer your question, Abhijit, there are multiple competitors of FITKNEES. The first one being Osteo. It's a Polish company called Asins that has developed this technology. They are trying to infiltrate the India market as we speak. The beauty of this device is that it gives you these 3D movement of the knee joint. The bad part is they're giving you parameters that you don't need clinically. Also, one lesson we learned from them was um, don't try to change the habit of the physiotherapist, add value to the practice. Ortho is trying to teach physiotherapists and orthopedics how to analyze from their data reports, and we have seen that the orthopedic or the physiotherapists are not adapting to that. Changing customer behavior is the toughest thing you're going to do. If you want to do that, you'll have to start giving freebies like Paytm did, or like Flipkart keeps giving us big discounts to help us get addicted to the platform. We'll have to do that. We cannot do that, especially in healthcare. Another global competitor of FitNeeds is something called a company called um, Wearables Private Limited. These guys have also made small wearable devices, but each wearable does one test. We are doing many tests with one wearable device, therefore ensuring affordability and profitability for our system and for the patients and physiotherapists alike. They have developed one device for one test, and therefore not a lot of smaller or medium level hospitals are able to adapt to them. I think other than that, there are a couple of others, but I'll kind of wind up over there.
Piyush Kumar has asked, for every startup having a great team matters a lot. So how did you find your team?
As I mentioned, it was a very difficult process. Um, First, to attract my co-founder was a big challenge. As I mentioned, I had to abuse him a lot. So he is my best friend, and therefore the abusing was okay. to up to certain level. You cannot abuse any co-founder walking on the street. Attracting him was one of the biggest challenges. I think the biggest challenge when it came to team building, because he was comfortable in his Intel job, uh, but I was able to actually understand him and so of my other team members. When you understand your people, their needs, their motivation, their drive, you're able to actually resonate with them better. This is a very important interpersonal skill that I think any startup founder should have, to understand what their team members want, what their customers want, what their stakeholders want, and kind of resonate with that. Once I had my co-founder on board, I found, I think after 8 months, we found our first full-time team member, Blessy. She's a she's a fourth year VIT student from biomedical. Now she's graduated, I guess. Uh, Still ambiguous what's happening, but she's now completed and now she's going to stay with us full time. What attracted her was the fact that that's what she told me, that she was continuously trying to do a lot of projects, but she never saw anything through. When we provided an atmosphere to her where we handheld her step by step, dividing all work into small, palatable modules, and then helping her execute those, that brought her confidence on herself. Eventually, we transitioned her from just a product development role into leadership role. It was very confusing for her, but that was something that she probably enjoyed. She's still learning, and her learning curve has been very high there. That kept her very continually engaged. Now she abuses us for everything. So now she's comfortable with the atmosphere and everything. As newest member, we found on internshala.com. He was working for 2 years at a robotics company which developed projects for children, and he actually wanted to transition into a more technical role. So when we were able to offer that kind of opportunity to him, he grabbed it. And even though the salary, I know for sure is less, these guys are not asking us for more because they themselves are so driven, and we have to find people who are so driven that they are motivated to work by themselves. And when they are not, we are there to always, of course, guide them and help them in the best way we can. So at the end of the day, a good team's definition is not, very intelligent or a team of very genius people or absolutely outstanding people. I think for a startup, a good team is somebody who's self-motivated, proactive, really keen on learning themselves. And that's what's going to give you the results that you want to achieve for your startup, not the best people in the industry, not yet.
Okay, so for the last question from the live chat, Lokesh Sethu would like to know the strategy used to retain experienced candidates.
So we have only one experienced candidate on our team. We do engage a lot of expert consultants. Especially Dr. Padmanabhan Shekharan has been somebody who was very difficult to get on board. He has done international level work with WHO and Cochrane level studies. But to kind of bring him on board with us and have deeper, meaningful relationship with us, what it took was continuously delivering results, showing progress, showing through our work and through our action the fact that we are potential and we are, we are going to go to another level. That is what is going to excite experienced people for sure. When they see that the work is exciting and it's going somewhere, it has a clear direction, it has a clear vision, it has a pathway, I think that is what will engage experienced people and retain them onto your team.
Okay, before we end, I want everyone in the viewers, everyone who's here participating, thank you for your time. Please check out Ashva Technology. Please check them out. Please check out V Electron Labs. Check out IEEE EMBS. Check out SABEST. Thank you for your time here. Before I end, I'll just thank a few people who've made this possible. Firstly, we're grateful to Ms. Anmol Saxena for taking time to come and interact with us. Your words have helped us get a better understanding of what Ashwa does and the essence of healthcare startups. We thank the entire team of Ashwa for collaborating with us. I'd like to thank everyone who's joined this session today for your patience and your participation. We are also grateful to VIT for this opportunity. Finally, thank you to all the faculty, coordinators, and teams of both SABEST and IEEE EMBS for their hard work. I hope that this was an enjoyable and informative event. Thank you all for now. That's it. Thanks for tuning in.
Thank you so much.